Welcome to The Explainer. Today, we're diving into something I find absolutely fascinating: facial anatomy explained. Seriously, if you've ever wondered about the precise anatomy of the face, or, just how your face actually works, you're in the right place. We're going to break down the muscles, the nerves, and the blood supply that make every single expression possible. Oh, and hey, before we even really get started, I want you to drop a comment below. Look for my pinned comment asking, what part of facial anatomy surprised you the most? Let me know as we go along. Think about it for a second. How does a single network of muscles allow you to smile, frown, and snarl all within a fraction of a second? Well, the answer lies in the fact that your face relies on this incredibly complex, just beautifully structured system. It's basically a masterclass in bioengineering. We're talking about literal puppet strings pulling on the skin, a highly sensitive electrical wiring system, and a dedicated plumbing network pumping blood against gravity. Okay, let's dive right into this. Here's our roadmap for today's explainer. We'll start with the muscle puppet strings, look at the neck and ear extensions, and check out the parotid gland hub. Then we'll map out the sensory wiring with the trigeminal nerve, the motor wiring with the facial nerve, and finally, the face's blood supply. All right, let's start with the muscles. Now, most muscles in your body connect bone to bone, right? To move a joint. But the muscles of facial expression, they are completely unique. They originate from the bones of your facial skeleton, sure, but they insert directly into your subcutaneous tissue and skin. So they literally act like puppet strings, pulling your skin to control the natural openings around your eyes, your nose, and your mouth. First up, we've got the orbital group, which manages all the movement around your eyes. The star player here is the orbicularis oculi, and that's the large circular muscle closing your eyelids. Just above it, sitting closer to the middle near your brow, is a tiny but incredibly powerful muscle called the corrugator supercilii. When you frown, this muscle creates those vertical 11 wrinkles right between your eyes. And actually, that's exactly why it's a primary target for Botox injections. Moving down to the mouth, here's where it gets really interesting. With so many muscles controlling our lips, they need a central anchor to keep everything organized. That anchor is called the modulus. It's a dense, structural intersection located just to the outside of each corner of your mouth. A ton of the oral muscles converge right at this exact spot, acting as a dynamic hub for the entire lower face. And when you look at the oral group, you can totally see why that anchor is needed. These muscles manage the incredibly complex movements of our lips and cheeks. You've got the orbicularis oris encircling the mouth to close your lips. Then pulling upward and outward from the cheekbone is the zygomaticus major, and that's your primary smiling muscle. But, okay, my personal favorite is this surprisingly long muscle with an equally long name, the levator labii superioris alacae nasi. Say that 3 times fast. It runs down alongside the nose and is responsible for elevating the upper lip to create that classic snarl expression. Next up, we have the nasal group, which, as you might guess, regulates the nostrils and the nasal bridge. The main muscle here is the nasalis. It actually has 2 parts, a transverse part that compresses the nostrils, and an alar part that widens or flares them out. A bit further up, right between your eyebrows, is the procerus. When you pull the inner corners of your eyebrows down, creating that horizontal fold across the bridge of your nose, that is the procerus firing. Now let's shift focus to the very top of the head, the calvary region. Your forehead movement is controlled by the occipitofrontalis muscle, which actually has 2 distinct bellies, one in the front and one in the back of the head. So how do they connect? Through the epicranial aponeurosis. It's this tough, fibrous band of connective tissue stretching right across the top of your skull. When the frontal belly contracts, it lifts your eyebrows and creates horizontal forehead wrinkles, giving you that classic look of sheer astonishment. But hey, facial muscles don't just stop at the jawline. Let's transition down to the neck to look at the platysma. Notice how this wide, flat, almost sheet-like muscle sits really superficially, right beneath the skin of your anterior neck. When it contracts, it tenses the neck skin and forcefully drops the jaw and the corners of your mouth. It's essentially the primary muscle you use to express intense horror or disgust. Okay, so now that we have our puppet strings mapped out, we really need to talk about where the wiring and the plumbing actually intersect. Enter the parotid gland. Yes, it is the largest of the major salivary glands, sitting right in front of the lower half of your ear, but functionally speaking, for facial anatomy, it acts as the major transit hub for the entire face. Now, this part is often misunderstood. The parotid gland isn't just sitting there minding its own business making saliva. It has absolutely vital structures weaving directly through its substance. The facial nerve, which controls facial movement, passes right through it. The external carotid artery, which is the main blood supply for the face, travels through it before branching. And the retromandibular vein, which handles drainage, is formed right inside it. This busy intersection is clinically massive. It means any swelling or surgery in the parotid gland can directly impact the feeling and movement of your entire face.
So let's pull back a bit and look at the wiring itself, starting with the sensory wiring. The sensation of the face, and we're talking touch, pain, temperature, is overwhelmingly handled by the trigeminal nerve, also known as cranial nerve 5. It splits into 3 primary divisions: the ophthalmic nerve, or V1, the maxillary nerve, or V2, and the mandibular nerve, or V3. And this brilliantly illustrates exactly how the body categorizes information.
Tracing the paths of these sensory zones reveals a really highly organized system. V1, the ophthalmic nerve, handles the upper zone, so that's your forehead, scalp, and upper eyelids. Then V2, the maxillary nerve, covers the middle zone, which is your cheeks, the sides of your nose, and your upper lip. And finally, V3, the mandibular nerve, supplies sensation to the lower zone, covering your lower jaw, chin, and parts of the ear. Now, comparing these systems side by side reveals a crucial distinction that trips up a lot of beginners. The green web you see of the trigeminal nerve is purely for feeling, but the yellow web of the facial nerve, that is purely for movement. Trigeminal equals sensory, facial equals motor. It is literally 2 completely different wiring systems running through the exact same house. So let's look a little closer at that motor wiring, the facial nerve, or cranial nerve 7. After it leaves the skull and enters that parotid gland hub we talked about earlier, it divides into 5 main terminal branches that spread across the face. These are the temporal, zygomatic, buccal, marginal mandibular, and cervical branches. These electrical wires spread out beautifully across the face. The nerve exits the skull at the stylomastoid foramen, enters the parotid gland, and just fans out. The temporal branches go high to power the frontalis up in the forehead. The zygomatic and buccal branches handle the middle face and mouth. And the cervical branch dips down low to control the platysma in the neck. Without these wires, those puppet strings we learned about earlier simply cannot move. And actually, that's exactly what happens in conditions like Bell's palsy, where this specific nerve becomes inflamed. All right, now that we have the strings and the wires down, let's talk about the plumbing, the pump system that keeps all these tissues alive. The primary arterial supply to the face is basically a step-by-step upward climb. It starts with the heavy-duty external carotid artery traveling up the neck. From there, it gives off a major branch called the facial artery. And eventually, the external carotid terminates by splitting into the maxillary and superficial temporal arteries. Focusing specifically on the facial artery, notice its incredibly winding and tortuous path. It curves tightly under the jaw, right where you can actually feel its pulse, by the way, travels deep to the platysma, and winds its way all the way up alongside the nose, finally terminating near the inner corner of the eye as the angular artery. That winding path isn't an accident. It's absolutely crucial. It allows the artery to stretch and move without tearing when your jaw and cheeks are fully expanded or moving dynamically. Now, while the facial artery definitely does the heavy lifting, we want to be scientifically accurate here and note that it has some help. Smaller branches provide essential backup blood flow. The maxillary artery pushes out branches to the infraorbital, buccal, and mental regions. Interestingly, you also get some supply from the internal carotid system via the ophthalmic artery branches near the eyes. Plus, the transverse facial artery crosses right over the cheek. It's just a beautifully redundant system to ensure your face literally never loses blood flow. And there you have it, the complete structural foundation of the face. We've explored the puppet strings, linking bone to skin, the dual system wiring that separates feeling from movement, and the winding plumbing network that keeps the whole system alive. Knowing how beautifully intricate this network is, I have to ask, what part of facial anatomy surprised you the most today? Let me know down in the comments. And if you enjoyed this clear, structured breakdown, make sure to subscribe for more simple medical explainers. Keep learning, and I'll see you in the next one.